With the 1889 Foundation being a health and wellness foundation, we really feel it's very important to support the medical education and training in our community. So areas such as nursing scholarships or nurse practitioner scholarships, mentoring in medicine for future physicians and future nurse practitioners. We're also providing full paramedic scholarships and also looking at ways that we can put funding into injury prevention, trauma prevention with our Stop the Bleed program, and even smaller programs like our Hunter Safety program that we're supporting, and also farm safety.
My name is Larett Weaver. I'm currently a registered nurse at Conemaugh Memorial Medical Center, and I work in the intensive care unit. When I originally started nursing school, I was interested in going into the intensive care unit. My end goal was to kind of go to nurse anesthesiology school. In order to be accepted into nurse anesthesia schooling, you need ICU experience. So whenever I first started nursing school, the intensive care unit was on my mind, but as I started doing my rotation in the ICU, that's when I really developed a true love for intensive care and taking care of very sick patients. I received a scholarship from the 1889 Foundation through my schooling, and by receiving this scholarship, it allowed me to truly focus in on my academics and not have to worry about working throughout my schooling. It allowed me to focus in more so on achieving good grades and becoming a full, well-rounded nurse.
Hi, I'm Mike Rodgers. I'm the program director at Conemaugh School of EMS here in Johnstown. I've been the program director here for about 8 months now. The biggest goals that I have for the program are the students' abilities to take in the knowledge and show it how they use it on the streets with patients.
So what really separates this program from a lot of others is how connected we are with the hospital and all the facilities we have here, all of the clinical rotations we get to do as a part of our program, which includes intubating patients in the operating room and in the ICU and getting to watch live births. Like, it's really amazing the stuff that we get to do at this program because of how connected we are to the hospital. My main motivation for becoming a paramedic was how much I enjoyed working as an EMT. I've gone to help my communities in ways I could never have imagined, and by becoming a paramedic I get to exhibit so many more skills and provide the highest level of care possible in the pre-hospital setting. And going down the road, I plan on going to medical school, so this will help me immensely by having such a great background and having helped so many people.
The best things I've done, I think, is just being out actually on the ambulance working with the other paramedics, learning from them now how to be the team leader and not just a team member.
The 1889 Foundation has given each one of those students a full ride scholarship to paramedic class. And I think if we continue to do this, we will have more and more students who are able to enroll in the paramedic and become paramedics. We do have quite a shortage of EMS folks on the street, and this will help greatly to improve the amount of paramedics we have on the street.
Whenever I first started the paramedic program, I wasn't really sure how I was going to handle the finances, the tuition of it, because quite a big amount out of pocket. I'm a single mom, 2 kids, working 2 jobs to get by. I knew I'd figure it out somehow, but the 1889 Foundation kind of figured that out for me.
So the 1889 Foundation, I was so thankful for the opportunity for that scholarship. Not having to worry about cost going throughout this whole program, which is something that has hindered a lot of people away from the program in the past, truly a blessing, especially as someone I was also a college student whenever I started this program. So having my college tuition on top of this one would have definitely been a lot.
My name's Tom Causer. I work at Conemaugh Hospital in the Trauma Services Department. My title there is Trauma Coordinator. I actually do the prevention, education, and outreach. One of the major things with trauma services is that you always want to look at prevention. And what we do with 1889 is collaborate with them to ensure that we're improving the safety of the region. 1889 then is our backbone. It's one of the areas that says that first step, how can I help you get started and get moving to do these projects with it? And they are the ones to say, yes, we are the ones going to partner with you to help you get this and make a community safer. If you look at trauma, the 2 major things that are the big killers in trauma is traumatic brain injury and then people that bleed to death. And then if you look at that and say, if the people that bled to death, what can we do to improve their outcome? And what it comes down to is that you have to have someone at the scene within that first few minutes that literally can stop the bleed. With Stop the Bleed, we're in that early phase of saying that you can save this person's life simply by coming up and doing a couple simple procedures on how to control the bleeding and stop the bleed. 1889 then said, you know, that's a great idea. Is there tools that they could use to help with Stop the Bleed? And we said, yes, the number one tool is education. And they're like, we will help you with that education, with the equipment, get those people to understand the importance of Stop the Bleed. Up to date, we're probably approaching 20,000 people that we've trained through this center and this project on how to stop the bleed. Now we're going back and re-educating, updating, and increasing the equipment in those areas. With the hunter safety program, what we looked at there is, again, what is our region? If you look at our region is filled with hunters, and those hunters like to go and take their children with that, and youth hunting is very big. Then we started looking, how can we improve the safety for those youth hunters? We went up to northern Cambria County, working with the trauma program manager up there, Tom Casella, and Miners Hospital, and said, you're in a prime region. He's the one who helped build it. We collaborated with the Level 4 Trauma Center, with the Level 1 Trauma Center, and the community to try to improve the safety of the youth hunters in the region. It takes hard work, dedication, and then moving forward more on the education level. Let people understanding what's happening, and then how can we improve so it doesn't happen again and again. 1889 has that same vision. Anytime I sit down with them, if I approach 1889 saying, we have identified this problem in this region, they're open to say, what can we do to change it, improve it, and improve the system, not simply put a Band-Aid on it.
As with everything that we're doing from 1889 Foundation, we're always looking at how we can leverage the grants that we're putting into the community with additional dollars, whether that's other local funders or state or federal dollars, that we can grow every single dollar from 1889 Foundation into additional dollars for our community.